Good morning. Welcome to Gateway 101. Okay, and we are back on live. Gateway 101 is live. Okay, Gateway 101 is live. Okay, Gateway 101 is live. Okay, so we're coming 1 minute. 1 minute. Gateway 101 is back on live. Okay. No. Okay, welcome back. This is Gateway 101. Okay, we're going to be talking about um, asthma. Yeah, we have a lot of asthmatic patients, and we have been receiving a lot of email. When I say a lot of email from our subscribers and from our fans that want us to um, to talk about this topic again. So we're going to be talking about asthmatic. Okay, this will be part two. Okay, because we did a previous video before on it. So this is going to be part two. Okay, so we said that asthma is a chronic long-term lung disease that make it harder to breathe because the airway in your lungs become a flame that is swollen, narrowed, filled with extra mucus, sensitive to triggers. So instead of air flowing smoothly in and out, the breathing tube tighten up, causing breathing problems. So these are some of the common problems with asthmatic patient. So what happened during asthma attack? Do not forget that in asthmatic patient with asthmatic patient, the lung, the airway become inflamed. That is, they become swollen and narrowed. So the part is swollen and narrowed, then filled with extra mucus. Okay, sensitive to trigger. So instead of air flowing smoothly in and out, the breathing tube tighten up. Do not forget it's already inflamed, it's swollen. So the breathing tube tighten up and it's already narrowed and filled with an extra mucus. In other words, in a simple language or in layman terms, your breathing tube is clogged. Okay, so causing breathing problems. So we're going to be looking about what happened during asthma attack. You will be hearing of asthma attack. What happened? So when asthma flops up, the airway reacts strongly. Do not forget that it's like you holding somebody nose and mouth, and he or she does not have any way of breathing. So you will be struggling. So that's exactly what happens when the airway become inflamed. Okay, the asthma flows up, the airway reacts strongly. So you will be struggling. So gapping for air. If somebody hold your nose and your mouth tight, so it's just, I'm giving an example. Okay, so your airway will be inflamed. So the airway will react strongly to something. So a trigger, okay, leading to tightening of airway muscles, swelling inside the airway, producing more mucus. So this make breathing feel difficult, like trying to breathe through a straw. Let's take that again. When asthma flew up, we're talking about what happened during an asthma attack. I will say that when asthma flew up, the airway reacts strongly to something, which is a trigger. So something trigger the airway to react. Okay, leading to a tightening of the airway muscles, swelling inside the airway, more producing more mucus. So this make breathing feel difficult, like trying to breathe through a straw. So what are the common symptoms of asthma? People with asthma may experience wheezing. That is the most common symptom of asthma. Okay, people with asthma may experience wheezing. It's like a whistle sound when breathing. So you'll be hearing this whistle sound when breathing. Shortness of breath. People with asthma also will be gasping for air sometimes. They have shortness of breath. Then the chest. Don't forget now, we're talking about the symptom of asthma attack. Okay. Sorry about that. We're back live. Sorry about that. A little bit of interruption. So the common symptom of asthma. People with asthma may experience, like I said, a wheezing, a whistle sound when breathing. You'll be hearing them. You hear that whistle sound when they are breathing. They have shortness of breath, the chest tightening or pressure. These are the common symptoms of asthmatic patient. Um, Coughing, especially at night or early morning. Most time not productive, sometimes productive cough. Symptoms can be mild or severe, and they may come and go. Okay, so what are the common asthma triggers? So what triggered asthma? Well, you hearing that somebody have asthma attack, asthma attack. So what are the trigger? What actually trigger it? So the common asthma trigger, asthma symptoms can worsen due to dust. Dust can trigger asthma attack. Cold air or weather change, sudden weather change can also trigger asthma attack. Vigorous exercises can also, like acrobatic exercise, strenuous exercise can also trigger asthma attack. Okay, smoke or strong smell, strong perfume can also trigger asthma attack. So avoid secondhand smoking. Don't stay around people that smoke cigarette or people who have this strong uh, perfume. If you know that you are an asthmatic patient, especially those smoking cigarettes, try to maintain a distance from them. Mostly if you are an asthmatic patient, because this can trigger asthma attack. Okay, so and also do not engage in vigorous exercise. Do not engage in vigorous exercise if you are asthmatic patient. Do not engage in a vigorous exercise. You can do a mild exercise, because if you engage in vigorous exercise, it might trigger asthma attack. And stay away from polio. dust, mold, especially polio. Even some people are allergic to pet. So things that you know you are allergic to, if you have an asthma, try to avoid it because it might trigger asthma attack. Okay, so smoke or strong smell, respiratory infection, cold can also trigger asthma attacks. Common cold can trigger asthma attack. If you're having a common cold, you can have asthma attack. It can trigger it. Even flu. If you have the flu, it can also trigger your asthma attack. Okay, stress or strong emotion can also trigger asthma attack. Okay, is asthma dangerous? Let's take this question. Asthma is usually manageable. Okay, it is manageable, but it is usually manageable, but severe attack can be life-threatening. Severe asthmatic attack can be life-threatening if untreated. With proper treatment, most people live normal, active life. But don't forget what we have just said, that severe asthmatic attack can be life-threatening if untreated. So in other words, you are having this asthma attack, your chest is tight, you are wheezing, and you hyperventilating. You have this whistle sound when you breathe. You find it difficult to actually breathe. Okay, so what we are saying here in essence is that if it is not treated, because we're talking about your respiration problem now, if it is not treated, it can worsen. It can worsen your. It can be life threatening. Okay, it can be life threatening. So with proper treatment, most people live their normal life. Asthmatic patients live their normal life with proper treatment, and they also live active life. So how is asthma treated? Do not forget that this does not constitute medical diagnosis or treatment. We're just going through, we're teaching you a basic health awareness, okay? Treatment often include quick relief inhaler for sudden symptoms. Most asthmatic patients do go around with inhaler, okay? Carry along inhaler. Controller medication, daily medicine to prevent attacks. Some of them, doctor put them on a medication they take daily to prevent asthma attack. So, and also try as much as possible to avoid triggers when possible. So we just make sure what trigger asthma. So if you know you're an asthmatic patient, things that will trigger asthma attack, please try to stay away from it. Okay, so let's look at some. Let's look at some simple home remedy, to help alleviate asthma attack. Let's look at some simple home remedy to help alleviate asthma attack. So, asthma can be scary and uncomfortable. So it makes sense to look for simple things you can do at home. Okay, just a quick reality check. Okay, asthma can be cured. No, asthma cannot be cured. I mean to say, so asthma can't be cured. But with home remedy and inhaler, medication treatment are still the best safe treatment. Okay, especially during attack, home remedy can help support breathing and reduce trigger, but they should not replace prescribed medications. Okay, so here are some simple safe home remedy that can help. Simple home remedy to help asthma symptoms. So steam inhalation for congestion triggered asthma. So if you have congestion, uh, you can use a steam inhalation. Warm steam may help loosen mucus and open the airway a bit. Okay, sit in a warm shower or breathe steam from a bowl of warm water or hot water. You can sit in a warm shower or get a bowl of hot water and inhale the steam. Okay, this might help loosen mucus and open up the airway a bit. Okay? But do not use if steam worsens your breathing. Okay, if steam worsens your breathing, please do not use it. Always be careful to avoid burns. Okay, so warm fluid, drink warm liquid can smooth airway and reduce irritation. Warm water, herbal tea, ginger or turmeric, warm soup or broth can also help. Okay, so ginger tea. Ginger has natural anti-inflammatory effect and may help relax airway muscles. How? Boil fresh ginger, slide in water for 10 to 15 minutes and drink a cup of it daily. So ginger tea has a natural anti-inflammatory effect and may help relax the airway muscle. Do not forget that during asthmatic attack, the airway muscle become inflamed, okay, and tightening. So ginger tea has a natural anti-inflammatory effect that may help, okay, replace airway muscle. So you just slice a fresh ginger and squeeze um, a lime or lemon on it. Let it after it had boiled for 10 to 15 minutes. Let it cool to a room temperature or a little bit warm. That you as much as you can tolerate, and drink a cup of it, 1 or 2 cups of it daily. So this help smooth the airway muscle. Turmeric milk, also known as golden milk. Turmeric contains calcium, which may reduce inflammation. So a half spoon of turmeric, warm warm milk of turmeric or plant milk would add additional honey to it. Okay, this avoid this if you have a gallbladder issue. Don't take turmeric milk if you have a gallbladder issue, or you're taking a blood thinner. Do not take turmeric. So you can take a turmeric milk, warm turmeric milk. It also help reduce inflammation of the airway muscle. Okay, so if you are coughing, you can use honey. Okay, honey may calm coughing, especially at night. So what you do, you boil warm water. Then when you let it cool, let it sit and cool a little bit, they add honey to see it. So, but not for children under age of 1. Never give honey to children under 1 year old. Never give honey to children under 1 year old. So you might boil water, a cup of tea, then add a little honey to it and drink. Okay, this will help relax the airway muscle mostly if you are coughing and or you have a throat irritation. Okay, so breathing exercise, this can improve control shortness of breath. Okay, you do pause lip breathing. Okay, inhale nose, exhale slowly through lip. This will help relaxes the airway muscle. Okay, so we can also, and the most important thing is this: avoid as much as possible. Avoid common trigger at home. This is one of the biggest home treatment. If you can avoid what triggered your asthma, mostly cigarette smoking, avoid staying around people who smoke cigarettes. If you're an asthmatic patient, and stay away from polio. If you're allergic to pets, stay away from pet, and stay away from mold. Okay, these are things that can actually trigger your asthma. So the yeah, so avoid this trigger because this is one of the biggest home treatment. Avoid trigger. Okay, reduce exposure to dust and mine. So wash bedding weekly. Smoke, never stay around cigarette or incense, because if you know that, because this can trigger your asthma. So, cigarette smoking um, is not too good. It's not good at all for asthmatic patients. Okay, so don't stay around people who smoke cigarettes. Strong perfume or spray can also trigger some people's asthma, so stay away from those areas. So if you're mold, okay, fix damp area quickly, because this can also trigger your asthma. So people are allergic if you're allergic to pet, so keep pet out of bedroom, because they could trigger your asthma. So do not forget to use humidifier if air is dry. Okay, clean your indoor air. Stay hydrated. Okay, um, and when asthma is an emergency, go to urgent care or ER immediately. When you are struggling to speak full sentence, go to seek medical help. Lip or face look blue, turning blue, seek help immediately. Wheezing is severe or worsen, seek medical help. And rescue inhaler is not helping, seek medical help. Go to urgent care immediately. Breathing feel very tight or fast. You're hyperventilating. You're wheezing seriously. Inhaler is not working. Go to emergency care. Okay. This would be stopping here this morning. Okay, but we're coming back this afternoon for more. Okay. Until then, this is Gateway 101. Thank you all for watching and stay blessed, for now.